name is Andrea Green, PN student, and today I am going to demonstrate medication administration. So first I will start off with hand hygiene, and today I have patient Shirley Cost, who is a female, 54 years old, and I will start by comparing my doctor's orders to my MAR. So I see that there is Refresh Plus Lubricant Eye Drops, 3 times a day for both eyes. And on here there's Refresh Plus Lubricant Eye Drops, 3 times a day per each eye. And I'm just going to put a little dot by it. And then I see Fentanyl 50 micrograms per hour, transdermal patch twice a day. Fentanyl 50 micrograms per hour, transdermal patch twice a day. So that is good as well. And then I see Augmentin 600 milligrams orally, twice a day for 7 days. Augmentin 600 milligrams orally, twice a day for 7 days. So that's good as well. Ibuprofen 800 milligrams orally every 8 hours. It's PRN for pain. Ibuprofen 800 milligrams orally every 8 hours, PRN. So that's good. And we have Lanoxin 250 micrograms daily and to be taken orally. Lanoxin 250 micrograms daily and orally. And then lastly we have Paroxetine hydrochloride 20 milligrams to be taken daily and orally. Paroxetine hydrochloride 20 milligrams PO daily. So those all match up with my healthcare provider orders. So now I can start by taking out the medication and making sure that it lines up with my MAR. And this would be my first check. So first we have Refresh Plus Lubricant Eye Drops. Refresh Plus Lubricant Eye Drops. Okay? And I will just take out this so I have it out. Next we have a fentanyl patch. Fentanyl 50 micrograms per hour, transdermal patch. Fentanyl 50 micrograms per hour, transdermal patch. And with that I will need an alcohol wipe. So I'll put an alcohol wipe with it. And then next is the Augmentin, 600 milligrams. Augmentin, this is 400 milligrams per 5 milliliters. So I have already done my math for that previously, and that is 700 milliliters that I have to give the patient. Sorry, not 700, 7.5 milliliters. And then ibuprofen 800 milligrams, PO every 8 hours. Ibuprofen 400 milligrams. So because they need 800 milligrams, I know that I have to give 2 tablets. Okay, and then I have my Lanoxin. Lanoxin 250 micrograms, PO daily. Lanoxin, this is 0.25 milligrams, but I know that that is the same as 250 micrograms. Okay, and then I have Paroxetine hydrochloride 20 milligrams. Paroxetine hydrochloride 20 milligrams. So all of my meds match up with my MAR. So now I can move towards the outside of my patient's room. And for this I will get gloves. Okay. I would do hand hygiene one more time before I put on my gloves. So this will be my second check where I will put the medications onto my tray for my patient. And just to make sure that the bin matches up with the patient, it is Shirley Cost, 54, female, date of birth 05/14/64, and that matches up. Dr. Leo, room 211-1, and it all matches up. Okay, so let's start with the eye drops. So Refresh Plus Lubricant Eye Drops. We need one, and it's for both eyes. So I can put this on my tray. Put this back in here. My fentanyl, 50 micrograms per hour. Fentanyl, 50 micrograms per hour. And this goes with an alcohol patch. Augmentin, 600 milligrams. And I had already figured out that I needed 7.5 milligrams. Okay. So I will find where I need to pour on the cup. And I will get down to eye level and make sure the bottom of the meniscus is at 7.5. Perfect. Okay, so I have my 7.5 milliliters of Augmentin. And then I have my ibuprofen, and I know that I need 2 tablets for this. We'll shake out 2 tablets. Okay, and then I can pour them in this cup. And I will be putting these in different cups in case the patient decides that they do not want it, as I have already spoken to the patient to take her vital signs when I had gone into the room earlier, and she had said that she was in quite a bit of pain. And then I have my Lanoxin. And that is 250 micrograms. So Lanoxin here. And then I have my paroxetine hydrochloride. So I know what all of these medications are for. The Refresh Plus Lubricant Eye Drops are to lubricate the eyes for dry eyes and to try and keep natural tears. The fentanyl patch is for moderate to severe pain. And the Augmentin is for a respiratory infection, which I can see on the doctor's orders that she was just diagnosed with pneumonia. The ibuprofen is PRN for pain. And then the Lanoxin is a heart medication for heart failure. And then the paroxetine hydrochloride is an antidepressant or anti-anxiety medicine. And I know that all of these are ordered, so they are correct. And now we can move into my patient's room. And I can take my MAR with me, my pen. Okay. So I would have done hand hygiene and put some new gloves on. And now I can address my patient. Hi, how are you today? Oh, good. I know I was in here earlier, but I have your medications for you. Yes, okay. Can I get your name and date of birth? Shirley Cost. And 5/14/64. Good. And I see that you have some allergies to promethazine and codeine. And it does say that on my MAR, and none of your medications today have those ingredients. So I'm just going to put the bed up to a good height. I'm going to sit you up. Is this a good time for you to have your medications? Yes? Oh, perfect. Okay, so I know you said earlier you were in some pain. Are you still in pain? Yeah, so you would like some ibuprofen? Okay, perfect. And I see that the nurse gave it last to you at 12:05 a.m. So since it is 8:55, I can give that to you. Okay, so for you today, I have some eye drops for your dry eyes, and I have a fentanyl patch for your chronic back pain. Yeah, and then I have some Augmentin, which is for a respiratory infection. I see you have pneumonia. Yeah, and then I have some ibuprofen for your pain again, and Lanoxin, that's for your heart. So before I give that, I will just have to check your apical heart rate. And then I have your Proxine hydrochloride as an antidepressant. So do you want to take your medications separately or all at once today? All at once? Okay, that sounds perfect. So I will start by doing the eye drops, and I see that you don't have any crusties in your eye and they look clean, so I can just give you your eye drops. So I will pull down the lower lid, and then I will drop one drop in and do the same with the other. Pull down the lower lid and drop a drop in. Okay, and then I can do the fentanyl patch. So I'm just gonna sit you up. Oh, and I see they put it on your chest last time. Perfect, okay. So I will just get my patch ready. Okay, and I am just going to initial it and put the time, or the date, and it is 09/26/19. Perfect. Okay, so I'm just gonna peel off this, and this is on your left upper chest, so I'll probably move it to your right upper chest. Perfect. And I will put it into an empty cup so I can dispose of it per facility policy. And then I will just wipe it off to make sure you don't have any extra medication on your skin. Okay, and now I would change my gloves as I had just taken off a fentanyl patch, and I can put the new patch on after I've changed my gloves. So I'm going to put it on your right upper chest. Perfect. Okay. And then I will just sign for it. And I've given it at 9 o'clock. And fentanyl, I gave it to you on your, and I would have changed my gloves before I had touched the pen. Right upper chest, so site C at 9 o'clock. Okay. And next is your Augmentin. So I have new gloves on, and now here's your Augmentin. Here, you can take it. Good. Okay, do you need any water to wash that down? No? Okay, perfect. Next, I have your ibuprofen. So you said you wanted to take all your pills at once? Yes? Okay. Let me just open up these ones, and then I'll put them all in one cup for you. Okay, and before I put the digoxin in, I'm going to check the apical heart rate. So I'm just going to check your apical heart rate to make sure you can have your digoxin today. Perfect. And your heart rate today was 75, so I can give you your digoxin because it was above 60. So I will place that in the container as well. Okay, so here are your pills, and I have some water here for you. Good. And here's your water. Okay, did those go down well? Yes? Okay, perfect. So that is all I have for you today. So I gave your PRN at 9:05. And I gave your digoxin at 9:05. Your heart rate was 75. Perfect. So that is all I have for you today. Do you have any questions? No? Okay. And I will be back to checking on you for about an hour to make sure that your pain has been managed. If not, we'll figure something else out. So I'm just going to lower your head before I leave. Okay, so before I leave the room, I would make sure my patient has their call bell, doesn't need anything like the washroom. Everything is tidy in the room. I would clean up my medications, and then I would go and dispose of the fentanyl patch by facility policy. And I would do hand hygiene before I leave, and make sure the room is tidy, make sure the patient's needs are all met. And that concludes this video.